Hello, and welcome to the AllergyEasy training video. Thank you for your interest in making this program a part of your clinical practice. It will be well worth the small time and effort required, and you will be one of those physicians leading the momentous and innovative change in this country to make sublingual allergy treatment available to all allergic patients. You will also receive an AllergyEasy training manual. While your manual contains all the details for incorporating the AllergyEasy program into your practice, this video is an important supplement. It is designed to help you better understand how to identify patients that will benefit from AllergyEasy, properly enroll them in the program, and learn the testing and mixing processes. Now, first things first, the diagnosis. Estimates suggest that at least 1 in 5 people suffers from some type of seasonal allergy, and that Americans spend billions of dollars each year seeking relief. There are the obvious symptoms such as runny nose and congestion, but there are also lesser known signs of allergy like conjunctivitis, chronic sinus infection, nasal polyps, and chronic ear infections. Even asthma, COPD, urticaria, and eczema are misdiagnosed and treated as chronic illness when they are actually the body's allergic reaction to allergens in the environment. When diagnosing a patient, start with an interview to find out just how severe the patient's symptoms are. Make sure the patient has filled out an allergy history form. Talk to the patient about the symptoms they listed on their form. How much discomfort do they cause? If you've established that the patient's symptoms are severe enough to limit their quality of life, ask about the duration of the symptoms. If patients suffer from any allergy symptoms for at least 4 months out of the year and medications are of minimal help, then the AllergyEasy program is right for them. After interviewing the patient, the next crucial step is the physical exam, and the nose is often the gateway to the most important information. Swelling and pallor of the nasal lining strongly indicate allergy. But what if the patient doesn't have the usual stuffy or runny nose? The answer is that they may still need AllergyEasy. That's because allergic patients may not always show visual evidence of their symptoms. They may have a terrible itching, but not a rash. They may have a history of asthma, but a temporary absence of wheezing. Even without outward manifestations, if a patient has underlying allergy symptoms, they need to be treated. Once you've determined that the AllergyEasy program is right for one of your patients, it is important to explain to them the theory behind desensitization. Remember, allergy patients typically jump from doctor to doctor seeking relief with little to no luck. Most of them are frustrated with current treatments and are unfamiliar with this revolutionary approach to treating allergies. You need to explain to the patient the specific benefits of the AllergyEasy method and its crucial role in the desensitization process. An example of this explanation and a script you can use is printed in the AllergyEasy handbook. You can cater your explanation of the AllergyEasy program to your own style and the needs of your patients. There is not a right or wrong way to deliver the message. Before you begin testing, there are a few items we need to cover. Some insurances pay for the office visit and related charging, such as testing. Some will not cover the serum. You will need to work individually with smaller and local network providers to determine the extent of their allergy treatment coverage. As you may know, the FDA has not yet approved the sublingual delivery of the serum. This may affect your billing to the insurance companies using CPT code 95165. We cannot tell you what codes your practice should use to bill. This decision must be left to each practice and/or biller to decide. However, there are miscellaneous codes and non-covered service codes that can be used. You can also consult our website or your AllergyEasy training manual for samples of some very important financial forms. For example, we recommend that regardless of a patient's insurance, you have them sign a waiver stating that they are aware that they are ultimately responsible for the cost of the AllergyEasy program. After this form is properly completed, the billing process will be simple and smooth. Before you test a patient, you need to discuss 2 key points with them: antihistamine use and pregnancy. Antihistamines can reduce the size of the test results. Ideally, patients should quit taking short-acting antihistamines at least 1 day prior to treatment and long-acting ones 2 to 3 days before. Many patients with severe allergies may feel apprehensive about stopping their medications or may have taken an antihistamine within the recommended time period, in which case, explain that some of the readings may be less than the sensitivity to that allergen should register. The important thing about giving the patient the 8-pack is that it will enable the patient to start the serum at a safe level. As for pregnancy, assure patients that it does not interfere with testing or treatment. If a patient becomes pregnant while taking the serum, she can continue it without adverse effects. After addressing antihistamines and pregnancy, discuss the antigen list. This is a list of some of the major antigens found in the patient's serum. This list should be sent home along with the patient's serum vials. Remind patients that the serum is a mixture of the world's major antigens, so they will be protected wherever they may travel. Now, the testing. Once the patient is comfortable with the program, both medically and financially, they are ready for testing. Here's how to prepare the testing set. You will receive a 5 cc vial of each of 60 separate antigens. Your individual vials may be kept in the 72-hole vial tray that can be purchased from AllergyEasy of Arizona. 3 20-well skin testing trays and 6 skin testing applicators per test are also required. Each 5 cc vial should yield at least 500 to 700 tests. Fill the well as follows. Filling the 20-well skin testing trays. Match individual vials of antigen with your 20-well skin testing trays. Each vial is pre-labeled for your convenience. Using 1 dropper full of antigen, fill each well with approximately 0.2 milliliters of the appropriate extract. Pay careful attention to assure that the antigens in the wells correspond with the labels on the trays. The 10-spot skin testing device should be inserted into the well immediately after filling to prevent the entry of foreign matter and to prevent evaporation. Take the skin testing device by the handle, taking care not to touch, contaminate, or damage the small end which contacts the patient's skin. Once your wells are filled with antigen and covered with a skin testing applicator, your system is ready for use. Store the system in the refrigerator at all times when not in use to maintain antigenic potency. It is recommended that the well trays be replaced at least every 6 months.